Good day, members. Just as I said in the first video, it was my goal to make sure we were open and that we were very informative as we reached out to you all. I want to make sure that we update you all on all the information and all the texts and all the emails that we get in respects to questions and concerns that the membership has. It is my goal to maintain at least the one video a week to ensure that you all stay informed on the going-ons, and we're updating you in respects to the questions that you send. As you may know, we've had 2 confirmed positives of COVID-19 in our department. One of the members was out on extended leave and has not been at work since mid-February. The other one was on callback as last week, as of this recording. We continue to pray for them and their family. We're a part of the community. Consequently, there's no way we could be separated from anything that happens to the community. COVID-19 is that as well. It is our goal, as always, to make sure that you all are as safe as possible. It is my highest priority to protect you as a member and also protect the community we serve. To that end, as you go about doing your business and taking care of our community, whenever you come in contact with a patient, ensure that you wear N95 mask, your goggles, and gloves. And whenever there's aerosol generation from the patient that you are caring for, you must also wear a gown, but only during that episode. Only wear a gown during possible aerosol generation from the patient. I want to remind everyone, this is going to be a marathon. If we were going to compare this to a football game, we are basically at the beginning of the first quarter. To that end, I want everyone to practice precautions. All the precautions that we are illustrating in all the bulletins, please read all the bulletins. These messages are only augmentations of the bulletins that we're sending out. We are continuously sending out several bulletins. And as you see, they change as the situation evolves. So you have to read your emails, you have to read your bulletins to ensure you stay up to date to the changes that we put in place for your protection and for the community as well. As always, I am very, very proud of you all, and I'm proud of the work that you do. I'm proud to be a part of this department. Remember our motto, pride protecting people. But I want you to know that the people aren't just the community, they are you as well. So I need for you to protect yourself at all times.
Well, we recently just published Ops Memo 0620, which cancels building inspections. As far as smoke detectors go, smoke detectors plays an important role in our job as emergency services. We cannot suspend this. Although the install itself is not an emergency response, a home having an installed smoke detector may prevent an emergency response and save lives. So this is something that we must continue. Simple answer. We are all members of the Baltimore City Fire Department. When we report to work, we are expected to take the calls we are dispatched to. Nobody is being carelessly exposed because we have the proper PPE and the proper training to wear that PPE at all times. MOP 360-2, Care of Protective Clothing, which was issued 4/1/03 and was recently revised 2/18/20. MOP 805-8, Infection Control Contaminated Clothing, issued 7/13/09, recently revised 2/18/20. I recommend all members read up on these MOPs. These clearly cover what to do with contaminated clothing for not only COVID-19, but for any contagious disease disposal of gear and clothing. When calls come into 911, we're sent an emergency response. So things such as unusual odors of smoke, investigation of smoke detectors, those should be handled as emergency responses until they're thoroughly investigated. So when you arrive on the scene, you should have your full turnout gear on, including SCBA and your face piece ready to be donned if required. Until this event is thoroughly investigated, to know whether or not it's an emergency or not. So it'd be very difficult to be wearing the PPE for a patient that we are having contact with when we have all of this gear on at that time. The training that was being done at Old Town was only being done so that we could get out the COVID-19 triage policy, and we could get that acting, which will help with our members once we have that policy in place. As far as the training and the cleaning goes, and the meetings held at the shift commander's office, everyone enters through the side door, comes up those steps, and they're to stay in that area. The other areas in the back, the computer room, that has always been entered by the rear steps, whether it's through recruitment, which has been canceled, or the IMT, which enters through that way. So they should not be going into the living quarters of Old Town. As far as the people coming for the training, it's up to company officers to ensure that those members are not wandering around the building, entering living areas for the members of Engine 6 and Truck 1. And cleaning, the FOA is responsible for cleaning the shift commander's office and that meeting area. And I believe there is already a cleaning service that does the back area by the computer room. So actually no additional cleaning areas have been added to the members of Engine 6 and Truck 1 at Old Town at this time. We now have 2 DOs out addressing the procedure for what to do if you have COVID symptoms either off duty or on duty. Please review them and use common sense if you're feeling ill or if you feel like you're having the symptoms that are handled with COVID. If you're unsure, use common sense, call your company officer and find out what's going on. Our department is going through a unique time right now. It's time for our company officers and battalion chiefs to step up and be strong officers. I have done my best to get our policies, procedures, and resources to the field. Officers need to ensure that the policies are being handled and followed, whether it's PPE usage or social distancing. At stations, our members also need to take responsibility for their actions.
I wanted to give a brief update from the EMS division. Basically, I wanted to give a little talk about a protocol we're rolling out. It's a viral syndrome pandemic triage protocol. Basically, MIMS, in response to the COVID-19 pandemic, drafted this pilot protocol that's temporary. And it's basically for us to use in instances of a viral syndrome. That's going to be anybody between the ages of 2 to 55, and they have to meet 2 of the 4 symptoms. And those symptoms are fever, cough, body aches, or sore throat. They can have no history of immunosuppression or medications that suppress your immune system for patients that are like, for instance, transplant patients or cancer patients. Also, they cannot be diabetic, have heart disease, COPD, or lung disease. Also, their vital signs have to be within normal limits. They also have to be able to ambulate or walk, and they have to be agreeable to the home care. The other point, we have to leave that home instruction sheet behind. Also going to follow up call 24 hours post-response. And that's going to occur in the EMS division. It's also going to be in the memo that this can be rescinded at any time. We have to make sure we follow what the protocol guidelines set out. This protocol only involves the viral syndrome. Some of the problems we had over the last week, and I kind of have to address. One is family members or loved ones riding in the medic. Most, if not all, hospitals in the Baltimore area are not allowing guests or visitors of any kind. There's only 2 exceptions. The 2 exceptions are for a minor, they'll allow an adult, or for an expectant family member. That would be somebody that's going to die, they'll allow a person in. I would strongly discourage people from riding in the medic. However, if they're really set on going to the hospital, let them. It's just the hospital's going to have to turn them away when we get there. One of the other problems we had, actually, it was 3 facilities over the last probably 5 days. The nursing homes. The nursing homes are trying to get our members to break their PPE. The 3 nursing homes in particular, I did contact the administrator directly by myself and made them aware that we, under no circumstances, will break our PPE. Please remember, do not break your PPE for any reason. You're actually exposing yourself. And actually, the memo that came out from the Maryland Department of Health actually states that if we're not able to take a temperature, a masked person is acceptable to come in, and we meet that criteria. We're all caught up. Everywhere we go, we're caught with this COVID-19. It's on TV, it's in the newspapers, it's on the radios. We have people that are worried about their family members and loved ones losing their jobs. I call it pandemic pandemonium. our medical professional triage. Right now we're real close, probably sometime next week we're going to start doing a nurse or paramedic medically informed triage at communications. There's been some questions about us actually scrapping Alpha, Bravo, Charlie, or Delta calls. We're actually going to start with strictly the Alpha and the Omegas. Omegas are actually lower than Alpha calls. We're basically going to farm those off to a nurse triage or a paramedic triage and try to work those through and save us from the transport. And if indicated, it'll derive that to an ALS response or a BLS response. Remember, protect yourself, protect your family, and protect your community. I think it's really important that we take time and unplug. I think Ms. Wood last week really stated it best when she said do some alternative ways of trying to relax and get yourself together.
As first responders, we deal with patients with many illnesses, viruses outside of COVID on a daily basis. It is true that sometimes they do not present with signs or symptoms. We have to approach each patient the same: proper PPE, proper social distancing, proper assessment. In these situations, is there a procedure in place to test members? Unfortunately, at this time, there aren't enough tests available. The tests are reserved for patients showing signs of COVID or highly suspected. A lot of the hospitals and medical facilities are ruling out other illnesses such as flu, strep, other illnesses like that before they use a test on COVID. It would take a lot of tests for us to test every member of the department on a regular basis. So at this time, that is not available. Hopefully in the future, as more tests become available, maybe we can look into that option for exposures. But right now, it's reserved for people who are showing signs and symptoms. If we're using our proper PPE, following the directives with proper PPE, there's little cause for concern of exposure. Remember, exposure doesn't mean infection. So if you're exposed, it doesn't necessarily mean that you're going to contract the disease. Social distancing, you want to stay away from people who are actively coughing. This is around the firehouse and in public as well. And to unknowingly contaminate high-risk civilians. If we're showing up, hand washing, wearing our PPE, if we're not reporting to work sick, that's the most important thing. If we're showing signs and symptoms, we don't want to report to work sick because that's when we're going to potentially infect our coworkers and the public. Just to clear up any confusion about proper use of N95 masks and the reuse of these masks, I just want to remind everybody after I go over this that they can always reference Operations Memo 4-20. It has everything detailed out, operational procedures. There are addendums to this, so you want to frequently reference this. Anytime you see it go out, you want to review it. The N95 masks are being reused. It is recommended by the CDC. You're going to get a new mask at the beginning of every shift, and times that you're going to replace the mask at the end of the shift, obviously. Any time that you're present for aerosol generating procedures, so if you're treating a patient who's being bag valve ventilated, intubated, nasal Narcan administration, CPR, CPAP, for example, those are the instances after the call you're going to replace your N95. Also, if the respirator is physically damaged or soiled, you're going to get a new N95 respirator. If it's potentially contaminated with blood, other potentially infectious materials, or if you have a suspected COVID patient who's actively coughing and you believe that maybe the droplets may have gotten up onto your face, remember that mask is protecting you. But if that happens in that instance, then obviously you're going to discard that mask and request another one. And then, of course, at the completion of your shift, you want to dispose of that mask and request another one. That's actually a great question, and I get this question a lot, and I think a lot of members are concerned about this. Probably one of the most important notes is just to remember, just because one of your coworker goes off sick does not mean that they're infected with COVID. They could have the common cold, they could have the flu, another illness. So we want to respect our coworkers' privacy, keep it to ourselves, don't jump the guns on hearsay, and let us investigate. Now, if it's reported that one of our members comes back positive for COVID, then the department and the infection control officer is going to start an exposure investigation. We're going to look on telestaff. We're going to pull up CAD reports. We're going to research a good bit to see who worked around that person when they were symptomatic, develop a timeline. Then we're going to interview everyone who was around that patient and make a determination from there by consulting with PSI. So again, if you believe that someone is sick, please don't assume that they have COVID. The most important thing is if someone is ill, please don't show up for work. Before you come to work, you should be taking your temperature, looking for new symptoms, new signs or symptoms, and calling out. There are procedure processes in place to make it a little bit easier for everybody, and so that we don't bring it in and potentially spread the illness to others.
We receive your questions for both medical directors as it relates to COVID-19 in an effort to better serve the community of Baltimore. The shift toward medically informed dispatch is an important one, and one that will continue well beyond the influence of this pandemic. Emergency response resources and personnel are one of the fire department's most valuable resources, and it is imperative to utilize them in a way that's consistent with best practices. There is not an accurate or reliable way to predict the severe demands that will be placed upon the system. An important first step in this reconfiguration of Select Alpha responses, which will cut down on the total number of emergency dispatches for both fire companies and medic units. An important first step in the reconfiguration of Select Alpha responses, which will cut down on the total number of emergency dispatches for both fire companies and medic units. To prevent unnecessary exposure and preserve response capacity, the command staff will continue to explore options that match the appropriate resource to the community's need. Another important thing to keep in mind is the potential for toxicity and effectiveness. There are proven strategies to minimize the spread of coronavirus, and the fire department is working with epidemiologists and infection preventionists to implement evidence-based tools. Currently, there is insufficient evidence surrounding the use of ozone therapies to impact disease transmission. UV light has emerged as another potential weapon in the fight against coronavirus, but its utility is currently limited to decontamination of devices such as reusable silicone masks. First, the scope of practice and protocols are outlined by MIMS. Though emergency protocols can be implemented, the fire department's critical care must be informed by the current edition of the Maryland Medical Protocols. Cardiac arrest represents a challenging clinical situation, and the data on intubation is less than promising. Ventilation is de-emphasized over high-quality, minimal interrupted cardiac compressions. RSI is definitely associated with increased first pass success rates, but Dr. Ben Larner's concern is about how to implement such a comprehensive program of training, QA and QI, and tight medical oversight under current conditions. He also believes that improvements are needed in airway control arsenals, in which he will work with both MIMS and the fire department to implement an ID airway algorithm that will minimize exposure and improve chances of first pass success. Though some jurisdictions have tried drug-facilitated intubation, this strategy is less than ideal. While compressions may facilitate the movement of air in and out of the lungs, passive oxygenation is not an ideal strategy to promote gas exchange in the non-breathing patient. The treatment for respiratory arrest is ventilation, not Narcan primarily. Even in hospitals under these extreme conditions is carried out by the most experienced providers and with the assistance of visual laryngoscopies, also known as VL. VL is used so that the provider can maintain sufficient distance from the patient during intubation attempt. King Airways are already being actively investigated as an addition to the EMS toolkit epinephrine, also known as EpiPen. And it can be considered for use in patients with static asthmaticus medication and is within protocols, and its use as a first-line medication must be justified accordingly. The risk of increased exposure and side effects from epinephrine must be weighed against the de-emphasis of albuterol. Both Dr. Larner and Dr. Geither are indifferent on the use of magnesium, simply because magnesium has been shown to improve certain respiratory parameters and rarely makes a life-altering difference in patients with severe disease. Since there is little risk to patients, he supports its use, but not its prioritization over albuterol or beta agonists. If you have any more questions related to COVID, please send them in to COVID questions 4, the number 4, BCFD@baltimorecity.gov.